The holiday decorations are coming down. There's no longer an endless supply of cookies and chocolate in my kitchen. It's basically that time of year when I like to treat myself to a little something special, or maybe a few little somethings special, which is where Quince comes in. Because Quince partners directly with manufacturers, they're able to pass their savings on to you. So you can get luxurious clothing and accessories at prices that are 50 to 80% less than similar brands. Now, I've got my eye on a couple of things that I think will go a long way toward brightening my winter mood. One is a dolman sleeve cashmere sweater that's priced at just under $40. And the other is a lightweight puffer jacket that's just $79.90 that I plan to take with me for some hiking in Sedona in a few weeks. Treat yourself this winter without the luxury price tag. Go to quince.com/nursemo for 365-day returns plus free shipping on your order. That's QUINCE.com/nursemo to get free shipping and 365-day returns. Quince.com/nursemo. Well, hello there. I'm Nurse Mo, and this is the Straight A Nursing Podcast where I teach concepts and share tips on how to thrive in school and at the bedside. So we are doing something new that I'm excited about for the Straight A Nursing Podcast, and that is these quick little shortie episodes on Mondays, and I'm calling them Mo's Monday Minute. So it's just a quick little tip or tidbit to help you advance your nursing practice, whether you are a student or an actual bona fide real-life nurse. And in this episode, we're looking at the kind of like what you need to think about when you are assessing your patient's pulse, or you look in this chart and you see that pulses have been documented as absent. And just a reminder here that if you are charting or seeing documentation that pulses are absent, this means the patient has absolutely no discernible blood flow to that extremity. This does not mean that you tried to palpate and you couldn't feel it, because if you try to palpate and you can't feel it, which does happen, you cannot chart that as absent unless you have actually gotten the Doppler device and really searched for a pretty, like you put in some A+ effort to find that pulse via Doppler. And if you still cannot find any pulse, then you can document it as absent. But absent does not mean that it's not palpable, because it might just be obtainable via Doppler. So this came up for me not too long ago. I was caring for a patient whose prior documentation showed absent dorsalis pedis pulses. And I thought that was strange because, the patient had some peripheral vascular disease, but not really super significant peripheral vascular disease. So, a little part of my nurse brain said, really? Are they really absent? I'm going to grab the Doppler and see. And guess what? They were easily obtainable via a Doppler device. So not only was this a documentation error, but it was an assessment error as well. So this is just my reminder that before you chart, the patient has an absent pulse, you got to get that Doppler out and you've got to try to find that pulse. Now, a couple of tips for finding a pulse with the Doppler is make sure you're using enough of that transducer jelly, and you want to make sure that you have your little marker available, because once you find that pulse, it's really kind of you to mark it so that the next time you come to assess it, you can find it quickly, and the next nurse can find it quickly. Now, that transducer gel will cause a mark to come off. So what I do, instead of marking the exact spot, because that's the spot where you're going to be putting transducer gel over and over again, it is going to wear off. I like to draw like lines kind of outside the area So one line going horizontally to where the pulse is, and another one going vertically, so that if you kind of look at it and you see where those two lines would meet, that's where the pulse is. And that way it doesn't get obscured, because you're going to keep putting that transducer jelly on there and that spot is going to get obscured over time. So make sure you do those things. And then the other tip I have for this is that it's often the angle at which you are holding your Doppler device. So first, let's say you've already marked it, or the prior nurse has marked where this pulse is, and you place the Doppler device and you don't hear the pulse. Don't panic. Start just slowly changing the angle of the Doppler device to see if that helps. And many, many times, that's all you need to do. You just need to be aiming directly towards that vessel. Okay, so those are my tips for using a Doppler and what I want you to be thinking about before you document that a pulse is absent. So I hope you found that helpful, and I hope you enjoy this Mo's Monday Minute series. I will be doing these every Monday, and another exciting change that we are doing with the podcast is we've made a lot of episodes. I don't know if you've noticed, but this one is numbered 381. There's a lot of back catalog material. So every other week, I will be pulling an episode from the back catalog that you might not have heard yet and bringing that to the forefront. These are going to be episodes that I think are especially helpful, or were especially popular, or that I have updated. So I will be bringing those to the forefront so that you see them and don't miss out on these really important topics. So I'll be in your podcast feed more often, and that just means we get to hang out some more, which I'm really excited about. So I will see you in just a few days. Bye for now. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.